Hi, my name is Sam Most, and this is the 8th video in a series of videos overviewing my textbook, Comprehensive Rhinoplasty, Structural and Preservation Concepts. This book is available on QMP Medical Publishers website, and it's the first book really to describe structure and preservation under one cover. Let's dive into Chapter 8, which is Preservation of the Nasal Vault. Now, this is a very hot topic and something that I've lectured about around the world at length, so in this brief video, I'm just going to give you an overview of the chapter, and for more details, I would point you to the textbook if you really want to learn more. Now, when we think about open structure rhinoplasty, and that's the way I approach basically all my patients, we really, in the past, had one way of treating the nasal dorsum, even though this idea of skin soft tissue envelope preservation and particularly alar preservation have been around for a long time, and we've published on these. Now we have this idea that we actually have a choice between dorsal resection or dorsal preservation. And the fact of the matter is, as I've lectured about quite a bit recently, is those are actually blurring now, and actually we have hybrid techniques whereby you do partial resection or partial preservation or convert a large bony cap into a preservation appropriate rhinoplasty patient. So this diagram gives you an idea of sort of the lay of the land with open structure rhinoplasty nowadays. It's beyond the scope of this really brief talk to go over a full evaluation methodology for patients, but I think there's a couple important things. And one is Lazovic's description of V-shaped versus S-shaped humps. And basically the concept here is whether the bony cap extends over the rhinion or not. This corresponds roughly to whether or not patients have long nasal bones or short nasal bones, roughly. Nowadays we can actually convert an S-shape to a V-shaped hump. A V-shaped hump is more favorable for dorsal preservation, and S-shaped is not. And if you think about it, it's because that curved shape will not change when you flex the dorsum downwards, so you're going to get a residual hump. But if you can actually push that back and convert it to a V-shaped hump by removing part of that bony cap, the cartilage does flex, and the flexion point is essentially that junction between the bone and the cartilage, then you can actually perform dorsal preservation on these patients. And this diagram shows you, again, short nasal bones versus long nasal bones, which roughly corresponds to what I just showed you. We use this terminology letdown versus pushdown, and basically it has to do with how we treat the bony vault. The cuts are essentially the same for both, but in one you perform an ostectomy and one you don't. In a pushdown, you don't perform an ostectomy. You actually impact the bones into the midface. With a letdown procedure, you actually resect the bone, and the bone sits on the face of the maxilla rather than being impacted into it. And we perform studies, and these diagrams or dissections show the effect of a pushdown versus a letdown on the nasal valve. And so for that reason, we recommend using the letdown method in most of your patients because it can impinge the nasal valve if you use a pushdown method. While that's the bony vault, the way we treat the cartilage of the septum varies greatly. So the traditional techniques of high strip resection or just immediate subdorsal resection are shown in the upper left. The central upper figure shows you a low strip, which is a variation of the caudal method shown on the right. There are intermediate strip methods which Ishida has described. The tetris method is shown in the bottom left, and the Z-flap method in the bottom right by a couple of colleagues of mine, Dr. Nevis and Dr. Kovacevic, respectively. But the method that I like to use is what we call a modified subdorsal strip method. The fact of the matter is that if you get facile with one of these methods, you probably do fine. But this is the method that I like to use, and in the textbook and in our videos, we describe it in much more detail. Essentially, you have a subdorsal strip that you split. It's like a mini caudal that actually flexes downward. These are examples of patients we treated that way. So this is a patient who underwent dorsal preservation with the modified subdorsal strip method. And in the textbook, we describe in more detail and show some intraoperative photos. This is another patient. These patients are all a year out, showing dorsal preservation. This patient also had functional issues, and it doesn't show in the diagram there, but she had a septoplasty and small spreader grafts placed. So she did very well with this method. And you can see you can achieve a straight contour for these patients very nicely. And when you palpate these patients, you really can't feel any irregularities. You can perform your structural tip rhinoplasty in these patients as well. So this is a patient who did not like her bulbous tip. She had some cephalic malposition. She also didn't like her dorsal hump, so she underwent the modified subdorsal strip dorsal reduction in addition to lateral curl repositioning. And I think we're going to talk about her later in some of the chapters on tip surgery. So the key points are preservation involves minimal disruption of the soft tissue and alar preservation as well as dorsal preservation. Those are the three main components. We talked about dorsal preservation in this chapter. And there are lots of different variations of how you treat the septum, but the way we treat the bony vault is essentially either a letdown or a pushdown laterally, and then bony cap modifications can be done as well. And these are all described in detail in the chapter. My preference for septal treatment is the modified subdorsal strip method, but there are a lot of different ways to do it. And in the chapter, we go into these in detail and have accompanying videos. This is just a really brief overview of the chapter. If you want more information, please check out the book, and thank you.